The purpose of this walkthrough is to take you through the Accreditation Standards Part 2 Evidence Guide. First, an acknowledgement of country. We acknowledge the traditional custodians of lands, seas and waters throughout Australia and pay respect to elders past, present and future. We recognise that the health and social and emotional well-being of Aboriginal and Torres Strait Islander peoples are grounded in continued connection to culture, country, language and community, and acknowledge that sovereignty was never ceded. This brief walkthrough is to introduce Part 2 of the Guidelines for Accreditation of Speech Pathology Programs, which details the accreditation documentation that must be submitted by universities for accreditation or reaccreditation. The document describes a number of key elements that require careful consideration prior to developing a submission for accreditation. These include, but are not limited to, specific definitions of communication and swallowing, transfer of knowledge and skills, and entry to the profession, as well as considerations regarding the use of COMPASS, the nature of practice education experiences, curriculum requirements relating to Aboriginal and Torres Strait Islander peoples and communities, and cultural and linguistic diversity. These components will be discussed in further detail within Video Guide 4, which we encourage you to view. Section 1 details all documentation submission requirements, including all mandatory components. While all components are crucial, we draw your attention to a few in particular. Firstly, your program narrative. Every program is unique and there is no one-size-fits-all approach to structuring your narrative. The key is to ensure accreditors who will have limited familiarity with your program can digest your narrative and come to a shared understanding of how your program prepares and assesses students for entry to the profession. Equally, accreditors need a detailed understanding of the academic assessments within your program. Of high importance are must-pass assessments that assess at a whole of cohort level student competency at a standard suitable for entry to the profession across the domains and standards of the professional standards, which you will use template 6 to document. Whole of cohort in this case refers to assessments that are common to an entire year level cohort, whereby all students receive the same assessment content and delivery and are assessed against the same criteria. Such assessments are important from an accreditation standpoint because they provide assurance of equitable and well-moderated assessment experiences. This does not lessen the value of practice education experiences, which are of course critical. However, practice education experiences cannot generally provide an identical experience for all students within a single cohort. Whole of cohort assessments address this issue, providing additional assurances that student competency has been assessed for all students in an identical way. It's also important to note that whole of cohort assessments that contribute to core claims of competency development must also be must-pass. That is, that students must pass the assessment to progress in the program. Speech Pathology Australia accreditors understand it's impossible for all assessments to meet such requirements, and so your submission should also separately detail any other key assessments that contribute substantially to the development of student competency, which you will use template 7 to document. Such assessments form part of the bigger picture of competency development within a program, and Speech Pathology Australia accreditors triangulate such evidence when considering how your program prepares students for future practice. It's important to note that templates 6 and 7 are of equal importance in documenting assessment within your curriculum. Accreditors will integrate information across templates 6 and 7 when considering a university's accreditation submission. Section 2 details key concepts that must be considered within a university's accreditation submission. The professional standards recognise the diversity of roles and contexts in which we practice, which is reflected within each of these concepts. Universities are encouraged to carefully review each of these concepts and their associated definitions prior to commencing preparation of their documentation. Please note these concepts will be further discussed in Video Guide 4. Section 3 describes the dimensions of evidence that are considered when Speech Pathology Australia accreditors are evaluating a university program. These are summarised here, but are also described in further detail within Appendix 1 at the end of this document. Speech Pathology Australia accreditors consider each of these dimensions very carefully when conducting an accreditation. Accordingly, it's absolutely critical that universities clearly map each of their key assessments and any associated claims of competency development to these dimensions of evidence. Consider, for example, a final exam for a given course. Your documentation should clearly demonstrate whether the exam is a whole of cohort assessment, whether it's must pass, the minimal level of competency required to pass, and so on. In doing so, accreditors are able to establish the extent to which a given assessment contributes to your overall claims of competency development within your program. Please note that dimensions of evidence are further discussed in Video Guide 5. To be accredited, Speech Pathology Australia requires 41 individual criteria to be met. Section 4 details each of these criteria and maps each one to the professional standards. Please note, the mapping to the professional standards is considered differently for criteria relating to governance and students relative to those that relate to curriculum. For governance and students, the mapping is done in recognition of the relevance of the professional standards to speech pathologists who work as education providers and academics. For curriculum, on the other hand, the mapping relates to how each criterion relates to the development of knowledge, skills, and attributes that a speech pathologist entering the profession must demonstrate. Section 5 provides a summary of accreditation standards and criterion evidence, which universities must submit using Template 8. The first two columns are pre-populated with the criterion description in column 1, along with the evidence universities are required to submit within their documentation in order to demonstrate they have met the criterion in column 2. In column 3, universities must briefly summarise what information they've provided and where it can be found within the documentation. This information assists accreditors in navigating your documentation as they determine whether each criterion has been met. Select criteria are populated with examples, which can be replaced with your own information when completing the template. Please note that this column is not intended as a list of documents for accreditors to consult, but rather is intended as a brief summary of the evidence that is presented and how it contributes to your claim. Appendix 1 provides further detail on each of the individual dimensions of evidence. Lastly, Appendix 2 provides a submission checklist to ensure all mandatory components of your submission have been submitted. Please also refer to the other accreditation video guides available.